Good evening. My name is Melissa Janssen, and I am in Professor Tovar's pharmacology class um, for the December cohort. And I am going to be talking about Module 4 assignment. The scenario is the Emergency Medical Services, or EMS, team has brought a 54-year-old female patient to the emergency department where you are working. The EMS personnel state that the patient was found wandering in a nearby park by a jogger who called 911 from her cell phone after the woman screamed obscenities at her and then fell, seriously scraping her arm and face. Excuse me. The woman is bleeding, disoriented, combative, and accusing the EMS team of stealing her purse. Her hands are shaking severely, and she is shouting at the doctors and nurses that she needs a bottle. The woman's clothing is dirty, and you can smell stale body odor and urine. The first question is, based on your first impressions of this patient's actions and appearance, what do you suspect she is suffering from? In my opinion, I believe that she is suffering from two different diseases. The first disease being a mental disease or a mental disorder of some form. The second disease I would say that she's suffering from would be alcohol withdrawals. The reason I say that, it could be alcohol or it could be any type of substance, but specifically I want to go with alcohol, and the reason for that is because um, when somebody is suffering from alcohol withdrawals, there are many types of indications that lead us to believe that they are going through alcohol withdrawal. And especially with her stating that she needs a bottle, the woman is disoriented, combative, she's severely shaking and shouting at the doctors. With short term alcohol disease, there's going to be several um, side effects that come with that. There's going to be poor judgment, lowered inhibitions, trouble concentrating, loss of coordination, raised blood pressure, passing out, vomiting, and depending on how long an alcoholic has gone without alcohol, they can have shaking, confusion, nausea and vomiting, unconsciousness. There is a side effect called DTs, and the medical terminology for that is delirium tremens, and this happens when a alcoholic has not had any alcohol in their system, and it is characterized by an altered state of consciousness with severe physical symptoms. Extreme confusion, visual hallucinations, auditory hallucinations, tactile hallucinations. So when she's stating that the EMS team stole her purse, I believe that she was hallucinating that that had occurred. Her shaking is going to be from the alcohol withdrawals as well because she has not had it in her system. Um, and then back to the mental illness. I believe that the two go hand in hand. So when you suffer from alcohol abuse or substance abuse, there's also an underlying mental disease or a mental um, disorder that goes along with that to inhibit a person to be an alcoholic. The second question, what short and long-term health risks would you suspect this patient faces? Um, for the short-term effects is going to be alcohol withdrawals. She's going to go through DTs. She is going to have the shaking, have the nausea, have the vomiting, and um, with alcohol, that is one of the only substances that you can actually die from when going through withdrawal. So it's important that she seeks help within either a detox or a rehab facility. Even the hospital can help her um, with the withdrawal symptoms because eventually she can have seizures, which could lead to death. So for short term, she's also going to have hygienic issues. She already is in dirty clothing. I'm assuming she um, has not washed her clothes. She probably hasn't showered. So we're going to deal with hygienic issues due to lack of care. Also, she could be in starvation mode. Um, if she is homeless or if she is in fact, an alcoholic, I'm pretty sure she would seek alcohol before she would seek any type of food. So she's at risk for her food intake and starvation. She's also at risk for a urinary tract infection or other skin infections due to her hygiene issues. Um, for her long-term health risks, we are looking at long-term substance abuse, depression issues, delirium, anxiety, and just her mental health in all in one. If she is going to face this alcoholism and detox off of it, then she's definitely going to need some mental health professionals to help her. The third question, why do you think the patient's hands are shaking, and what do you think causes her confusion and combativeness? For me, I believe the shaking could be for several reasons, such again as alcohol withdrawal, lack of food or water, other underlying health issues. Um, Maybe she's suffering from low blood sugar. Maybe she is um, in the early stages of Parkinson's. There's just a lot of other underlying illnesses that can cause the shakiness. I apologize. Number four, what assessments do you think are needed for this patient? First, I believe in the emergency room, she needs to have a physical examination from head to toe. She does need to have lab tests done, such as a CBC, blood sugar, urine, a liver and renal function test, or blood tests that can tell us where on the scale she's at. The blood sugar, because that could tell us if she um, has low blood sugar. And then lastly, she will need a mental health assessment. And this can be done also in the hospital. Somebody can come and see her within the facility and then eventually refer her out to um, another mental health physician. With the last question, this is the research question. Mental illness management includes both pharmacological and other therapeutic methods for treatment. Summarize how this is managed and the support of insurance. Is it sufficient? What could make it better? Be specific with your statements. So, mental health illness management includes both pharmacological and therapeutic methods for treatment, which means medication management. A patient could be put on medication for depression, anxiety, bipolar, borderline personality disorder, schizophrenia, as well as followed up by therapeutic methods such as counseling, um, different therapies such as DBT or um, dialectal um, therapy, which is going to be a group session and also a one on one session, and that's used for borderline personality disorder. When it comes to insurance, I believe that the insurance is definitely supportive to a certain extent. I don't believe that the insurance companies um, help in such a way that a person can go from start to finish with an issue. A lot of the times there's going to be co-pays where people who suffer from mental disorders are already either at home on disability, they can't work because of their disability. And so when it comes to income, it's already hard enough for them to pay the bills, let alone pay a copay to see a psychiatrist or a psychologist, you know, um, 2 to 3 times a week, let alone even once a week. Um, Also, if you don't have insurance because your disability or your mental health causes such a disability that you don't have insurance to pay for it, then the average person, unfortunately, is unable to pay for any type of mental health services unless you're going through Medicaid. And with the state Medicaid here in Arizona, it is very difficult to actually get an appointment um, for mental health. A lot of the times you have to go through a phone interview to see how severe your symptoms are. Then you have to wait for a call back, and then they do an over the phone um, type triage situation. And then from there, they place you with a um, mental health treatment provider, which can take up to 2 to 3 months to get this process completed just for your first appointment. So when it comes to insurance, if it's private insurance, I think that's going to be the best route to go. But again, a lot of people who suffer from mental health disorders um, don't have the ability to keep up a job and have private insurance, such as Aetna, Cigna, through an employer. A lot of patients are either going to be on Medicaid, which is the state insurance, or they're going to be self insured, um, meaning self pay. And again, they don't have the the funds to take care of that. So it's definitely going to be difficult for any type of patient to receive medical treatment. Now, the references that I used for all of this, the first one is going to be the HHS Public Access, which is Health Aff, and it's by Millwood, 2013, October. And um, the other one is going to be the N. Let me see here. Give me just a second. Okay, and the other citation is going to be by Kyle J. Schmidt, Mitesh R. Doshi, Jenna M. Holzhausen, Alicia Navadio, Megan Cadiz, and Jim E. Gardner from the Annuals of Pharmacotherapy 50, pages 389 through 401, dated 2016. Thank you.